Hi, this is Mr. Smith. He came for a skin review. Please take a focus history and describe the examination findings.
Hello, my name is Daniel. I'm one of the foundation doctors. Do you mind if I just check your name and age?
Yes, certainly. Yeah, my name is Stephen Sentence, date of birth 31/7/51.
Excellent. Would it be alright if I asked you a few questions about why you've come in today and had a look at your feet, if that's alright?
By all means, yes, no problem
Excellent.
at all.
So I understand that you've come in with a problem with your skin, is that right?
Yes, that's correct. Yeah, I was referred here by my GP. I have a long history of skin problems, dryness, etc. And my current GP thought it was time that I came to see a dermatologist because of the history, a long history.
Okay, tell me back to the beginning when all this started for you.
Well, my family have a history of skin problems, myself, and I have a brother who also has a history of skin problems, but personally I wasn't really aware of my skin condition until I was probably in my early teens, around about 15 years of age. I did go to see doctors before that. I remember my mother taking me to Children's Hospital in those days because of skin problems. I've been to see doctors constantly for many years now, and they've really just been treating me with creams, etc., and it's never got any better, it's never improved.
So this is something that you struggled with since a child and it's never really gone away for you?
Absolutely, yes. Yeah.
Okay. And what sort of symptoms do you have with this?
I've had, from an early age, I remember having crustiness in my head. My feet have always been, the skin on my feet, even the topical creams that I've been putting on, don't really do any good as regards that. The skin is thick, it peels very badly. My legs, I have skin that is almost like a fish's. It scales, and I can literally pick scales of skin off. Doesn't hurt, but I can literally pull skin off, and it reappears. It's just there again. So I have generally spots around my body, you know, rashes, this sort of thing.
So this is something that affects your whole body, including your hair as well?
Yes.
Fine. Any changes in your nails at all?
My nails, yes, strangely enough, my nails do, for whatever reason, seem, I wouldn't know the name of it, but they do seem very hard, and they're not smooth. It does affect my nails, yes.
Okay, that's something we can look at later as well. You mentioned that your skin sort of peeled off. Does that cause you any pain at all?
No, not at all.
Fine, so this rash doesn't cause you any pain at all?
No, no.
Okay, what about any other sort of physical sensations, so like itchiness or anything like that?
No, strangely enough, I never have. My GP has often asked me, and was quite surprised that there was no itchiness, but no, I never had any itchiness sensation or anything. They're just there, basically.
Okay, you mentioned that your skin sort of came off a little bit and was quite scaly. Is it dry or wet?
Dry.
It's very dry, is it?
Very dry.
Do you ever get anything coming out of your skin, any sort of discharge or bleeding?
No.
Fine. And are there any areas in your body where this has got worse suddenly, or any enlarging areas?
Probably on the legs itself, around the calves, etc., seem to be quite bad. But apart from that, they just come and go in various. I have various areas, various patches where things happen, and then usually you can sort of keep it under control by creams and emollients, but then it comes back again. As soon as you stop putting the cream on, it's back again, and it's very vicious sometimes, you know. The weather makes a lot of difference to it. Doesn't like humidity, doesn't like the cold, so extremes in temperature or humidity does affect it quite badly.
Okay, so the creams and things make it better, extremes in temperature make it worse. Anything else that makes it better or worse?
No, not really. Not really. It is just there all the time. Basically, it never really gets that better that it goes away.
Fine. Okay. You mentioned that you tried various creams and treatments over the years. What medications are you taking at the moment?
Just one really, propanolol, and that's about it. And generally, I'm fit and healthy otherwise.
So no other medical conditions apart from this?
No, a little bit of blood pressure, but apart from that, it's
Is that
under
what the
control.
propanolol's
Yes,
for?
yeah.
Okay, brilliant. Are you allergic to anything at all?
No.
What creams and things are you using on your legs at the moment?
Just topical creams.
Like a moisturiser?
Yeah, moisturisers, etc. Just general moisturisers. Just to try and keep on top of it.
Anything else you apply to your skin at all?
No, not at the moment.
And did you mention if you had any allergies or not?
I've not got any allergies.
Fine, perfect. A little bit earlier on you mentioned that your brother and your family had skin conditions previously. Has that been looked into at all?
It has, yes. My brother is, it's actually been diagnosed as having a particular skin problem, and he is on tablets for it. And so he is worse than me in actual fact. His skin is almost like the bark of a tree.
Does he have the same condition you have?
Yes.
Fine. Has that been identified then?
It has.
Okay, we'll have to have a look in your letters to have to see what they've actually called that then for you.
Yeah.
Fine. Just a little bit more information about you, if that's okay. Are you working at the moment?
I'm not. I'm retired at the moment.
Oh, excellent. And what did you do before you retired?
I was an engineer for something like 30 years, and then I finished off as a driving instructor.
Oh, good. When you were working as an engineer, any exposure to chemicals or anything that made your skin worse at work?
No, not at all. I generally made sure I always used barrier creams, you know, on hands, etc. No, I'd never found that the engineering oil, etc., made it any worse or any better. It didn't seem to affect it. Didn't seem to make any change.
One of the other things we're interested in when we look at people's skin is how much sunlight they've been exposed to. So any periods working abroad, any long holidays, or any sunbeds?
No, my skin doesn't like too much sun. I do apply suntan lotions readily because I do burn very easily. But apart from that, no, I haven't noticed any difference. It is just humidity. I do notice a big difference with humidity. It doesn't like humidity and cold.
Last question quickly before I have a look at your legs, if that's okay. Do you smoke or drink any alcohol at all?
I drink a small amount of alcohol, about 3 units a week, just a small amount.
Perfect. And do you mind if I have a look at your legs?
By all
so if you roll those up for me, I'll have a quick look. So normally at this point I'd examine the hair, nails and do a full skin inspection, but for the purposes of this I'm just going to have a quick look at the legs, if that's okay. So we're looking at bilaterally, there's a symmetrical rash present on the flexor and extensor aspects of the calves and on the soles of the feet. It's erythematous, it's scaly, there appears to be quite dry patches. Some areas are slightly worse, so there's 2 centimetre by 1 centimetre patches there. There's generalised crusting, and there doesn't appear to be any discharge, exudate or bleeding. And at that point I'd also palpate to look for temperature.
Okay, thank you. I will ask now 2 questions. The first one is, please present the important findings and suggest a diagnosis.
Okay, so this is a gentleman who's presented today with a long-standing skin condition. The background of this is that he's had it since he was a child. It's possibly a genetic condition, as his brother suffers from the same condition, and it's been investigated previously by both consultant dermatologists and GPs. Throughout his history, he's been treated with a variety of topical therapies, none of which have managed to resolve the condition completely. The main characteristics of the skin condition are that it affects both his nails, scalp, hair and skin all over the body, worse than the feet and the legs. It's characterised by skin that easily peels off, so it's very exfoliative. It's not associated with any other symptoms such as pain, itchiness or any discharge or bleeding from any of the points. In terms of treatment at the moment, he only takes propanolol. He's using various topical remedies such as emollients, which seem to help control the condition.
So how would you go on to investigate and manage the patient presenting for the first time with this condition?
So if presenting for the first time with this condition, I'd want to refer them to possibly genetics for some further genetic studies. I'd want them to be seen by dermatology, where they may want to do things like a skin biopsy, any blood results to look for characteristic inflammatory markers. And I'd probably conservatively recommend continuing to use an emollient, maybe use an ointment that's slightly thicker to try and retain moisture in the skin. I wouldn't want to start any other medical therapies at this point before we got a definitive diagnosis.
Okay.